Hello everyone, this is VENTI channel. Today I'd like to show you our case of 56 years old female plantar fasciitis or 2 years history of plantar fasciitis on the right foot. We did the MSK embolization 10 procedure for this patient by using a 3 French sheaths on the ipsilateral antegrade puncture from the right groin and inserted the angiocatheter and microcatheter. I will show you the movie. Now I'm inserting the microcatheter into the popliteal artery and insert it into the posterior tibial artery. That is the main target artery of plantar fasciitis. Now I'm inserting the microcatheter into posterior tibial artery and insert it to the ankle joint level. This microcatheter is Asahi Berute. There is a small curve and we can make the direction by using a torqueability. So now we are changing the direction laterally, and we want to see the lateral view because it's much easier to identify the target vessels like this. And now the microcatheter is located at near the ankle joint level. I will insert the microcatheter more like here. Okay, so from here we can do the super selective angiography from here, the baseline angiography. Let's see the DSA angiography. We can see the abnormal brush, and also we can see the venous drainage as the target area here. And then we want to insert the microcatheter from here to this level. And there is a small branch. The name is calcaneus branch here, so we want to insert into the calcaneus branch. But I noticed that there is some curve, so we cannot go over the curve. So I decided to use a micro guide wire. Yes, we can see the brush here, and the calcaneus branch is here. So we want to insert the microcatheter more deep area into this branch. So I use the micro guide wire. This is a movie during the selection of using micro guide wire, but the shape of guide wire is not so fit to this curve. So I changed the shape of the tip of micro guide wire to fit this curve. Okay, so now I try again to go to this branch, the calcaneus branch. It's very near, and we shape the guiding wire, the shape to the sigmoid shape, and it's much easier, becomes much easier to select this branch, like this. And after that, inserted microcatheter. Here, the microcatheter tip is here, and from here, we want to do the super selective angiography. This is a super selective angiography from this branch. Okay, so we can see the brush here. This one is our target. So from here, we want to infuse the embolic material. And we cannot use a permanent microsphere from here because we cannot avoid the non-target embolization to the fingertip. So we use a temporary embolic material. We recently have several options, imipenem or Lipiodol. But this case, we use the NextSphere F, the gelatin microsphere. Now I'm preparing some NextSphere F. The usual 1 vial of NextSphere F containing 200 mg of NextSphere F, we put the 10 cc of saline and the 10 cc of contrast, total 20 cc, and use 0.1 or 0.2 cc incrementally. Now I'm checking the blood flow. Yeah, so from here, Okay, so now we are now waiting for several minutes after the first injection to second injection. Then usually resorbable particle, or even though the permanent, it will redistribute within 5 minutes or 10 minutes. So we can check again, and sometimes we can see the remaining brush, and so we can infuse more, add more the embolic material after the finding of remaining vessels. So now we put the small amount of Nexpert F again and perform angiography again. So now I'm now doing the final follow-up angiography now. So we can see the diminish of brush from here. So maybe we can wait more 5 minutes and we can check again. But we usually do it 2 times and finish the procedure. This is a good endpoint of this procedure, so I can finish this procedure. So now this is the final angiography. You can see the diminish of brush and the blood flow reduced, and but still remains normal blood flow to the peripheral tissue. So that is a good endpoint of this procedure. So today I briefly introduce you our procedure for plantar fasciitis using Nexpert F. So if you have comments or questions, please describe in the comment area, and see you again. Bye bye.